It can feel incredibly frustrating, can't it? One moment, things are working just as they always have. Or maybe just a little slower than they used to, which is natural. And then, seemingly out of nowhere, you start noticing changes. It's like flipping a switch you didn't even know was there. Things aren't quite right down there, and it's confusing, maybe even a little worrying. You think to yourself, what's going on? I'm taking care of myself, seeing the doctor, following all the advice. But despite all your efforts, this essential part of your life is becoming a struggle. Or perhaps it's just stopped working the way you remember. You might feel a sense of loss, maybe embarrassment, and definitely a lot of questions. You might wonder if it's just age, something inevitable you have to accept. But what if there was another reason? Something you might not even suspect, hiding in plain sight. Something you're actually doing to help yourself in one area, but which could be unintentionally causing problems in another. It's a reality many men face, especially as they get a little older. The body changes, sure, but often we overlook something crucial, the medications we rely on to stay healthy in other ways. It's not often talked about openly, and sometimes even doctors don't immediately connect the dots unless you bring it up. But certain common medications, prescriptions you might be taking every single day for perfectly good reasons, could be the hidden culprits quietly undermining your erections. It's a sensitive topic, I know, but it's an important one, because understanding this could open up new possibilities and conversations with your doctor. In this video, we're going to look at 5 types of common medications that could be killing your erection without you even realizing it. It's not about pointing fingers or telling you to stop anything you're taking. Absolutely not. It's about awareness and empowering you with information so you can have informed discussions with your healthcare provider about your options. You might be surprised at what you learn, and it could make a real difference. So, let's dive in and explore these potential hidden factors together. Watch to the end for something that will really surprise you about how these things connect. Now, let's start with the first category of medications that can sometimes play a significant role in erectile difficulties, and it's one of the most common types prescribed, especially as we get older: blood pressure medications. Millions of people rely on these medications every day to manage hypertension, which is high blood pressure. And make no mistake, controlling blood pressure is absolutely vital for preventing serious problems like heart attacks, strokes, and kidney disease. You should never stop taking these medications without talking to your doctor. But while they are doing crucial work for your cardiovascular system, some of them can, for various reasons, interfere with the complex process required to achieve and maintain an erection. Think about what needs to happen for an erection. It's a marvel of the body's hydraulic system. It requires healthy blood vessels, proper nerve signals, and a delicate balance of chemicals. Blood needs to flow into the penis and then be trapped there. This involves the relaxation of smooth muscles in the penile arteries, allowing increased blood flow, and the constriction of veins that drain blood away. When something disrupts this process, it can make erections difficult or impossible. Certain types of blood pressure medications can do just that. A prime example are beta blockers. These are often prescribed for high blood pressure, but also for conditions like angina, irregular heartbeats, and even anxiety. Beta blockers work by blocking the effects of adrenaline and other stress hormones on the heart and blood vessels. This slows down the heart rate and relaxes blood vessels, which helps lower blood pressure. However, adrenaline also plays a role in the overall function of the nervous system, including the signals that help initiate and maintain erections. By blocking these effects, beta blockers can sometimes dampen the body's ability to respond to sexual stimulation, making it harder for blood to flow into the penis and for the erection reflex to kick in. People on beta blockers might find that they have less spontaneous erections, or that achieving an erection takes more effort and is less firm. It's not a guaranteed side effect for everyone, and it varies from person to person, and depending on the specific beta blocker prescribed, but it's a known potential issue. Another group is thiazide diuretics, often called water pills. These are also very commonly used for high blood pressure. Diuretics help the body get rid of excess salt and water, which reduces the volume of blood flowing through the vessels, thereby lowering pressure. While they are effective at this, some studies and clinical observations suggest that thiazide diuretics can also contribute to erectile dysfunction. The exact mechanism isn't as clear as with beta blockers, but it might be related to changes in blood flow or even affecting levels of testosterone, although that link is debated. Some men on these medications report a decreased libido as well as difficulty with erections. Again, this isn't universal, but it's a side effect worth being aware of. It's important to remember that not all blood pressure medications have the same impact. Other types like ACE inhibitors, ARBs, angiotensin II receptor blockers, and calcium channel blockers are often considered less likely to cause erectile problems compared to beta blockers and thiazide diuretics. Sometimes, simply switching from one class of blood pressure medication to another can resolve or significantly improve erectile function without compromising blood pressure control. This is precisely why open communication with your doctor is so vital. If you are taking a blood pressure medication and experiencing issues with erections, mentioning this side effect to your doctor allows them to consider if an alternative medication might be a better fit for you, balancing your cardiovascular health needs with your sexual health needs. They might be able to adjust the dose or switch you to a different drug within the same class, or a completely different class, that is less likely to cause this particular side effect. You might think it's just something you have to live with, but that's not always the case. There are often other options available. It's also worth considering that the underlying high blood pressure itself, separate from the medication, can also damage blood vessels over time, including those in the penis, contributing to erectile dysfunction. So, managing blood pressure is crucial for long-term sexual health anyway. The key here is to distinguish between the effects of the condition and the effects of the treatment, and that requires a conversation with your doctor. Don't assume it's just the condition or just your age. It could be related to the medication you're taking to manage the condition. For example, a man might be taking a beta blocker for high blood pressure, develop ED, assume it's his age or the high blood pressure itself causing the issue, and not realize that a conversation with his doctor about trying an ARB instead might make a world of difference to his erections while still effectively managing his blood pressure. This awareness is powerful. So that covers the first common category, blood pressure medications, specifically highlighting beta blockers and thiazide diuretics as potential culprits. It's about understanding that while essential, they can have unintended consequences for sexual function, and there are often alternatives. Now that we've discussed how managing blood pressure can involve medications that sometimes impact erections, let's move on to another group of medications that are incredibly common and widely used, but which also have a known link to sexual side effects, including difficulties with erections and libido. Next up, we need to talk about antidepressants, particularly a class called selective serotonin reuptake inhibitors, or SSRIs. These medications are prescribed for depression, anxiety disorders, obsessive-compulsive disorder, and other mental health conditions. They work by increasing the levels of a neurotransmitter called serotonin in the brain, which helps improve mood and reduce anxiety. For many people, SSRIs are lifesavers, significantly improving their quality of life and helping them manage debilitating symptoms. However, serotonin plays a complex role throughout the body, not just in the brain, and its increased levels can affect various bodily functions, including sexual response. Sexual side effects are among the most frequently reported side effects of SSRIs. These can include a decreased sex drive, libido, difficulty achieving orgasm, and yes, difficulty getting or keeping an erection. The exact way SSRIs cause these problems isn't fully understood, but it's thought to involve the way serotonin affects other neurotransmitters, hormones, and nerve pathways involved in sexual arousal and function. Some men on SSRIs find that even if they feel desire, their body doesn't respond the way it used to. They might have trouble getting firm enough, or the erection might not last. It can be particularly frustrating because while the medication is helping with mood, it's creating difficulties in another important area of life, which can, in turn, negatively impact relationships and self-esteem, potentially even counteracting some of the positive effects on mood. The incidence and severity of sexual side effects can vary widely depending on the specific SSRI medication, the dosage, and the individual person. Some people experience these side effects, while others don't. Sometimes the side effects lessen over time, but for many, they persist as long as they are taking the medication. This can put men in a difficult position, needing the medication for their mental health, but struggling with its impact on their sexual health. Again, the absolute last thing you should do is stop taking an antidepressant on your own. Suddenly stopping these medications can lead to withdrawal symptoms and a return of the original mental health issues. However, if you are on an SSRI and experiencing sexual side effects, it is crucial to talk to the doctor who prescribed it. They are aware of this potential issue and have several strategies they might consider. They might try lowering the dose, if appropriate. They might suggest switching to a different antidepressant medication that is less likely to cause sexual side effects. Some antidepressants, like bupropion, Wellbutrin, are known to have a lower incidence of sexual side effects compared to SSRIs. Or they might explore adding another medication to counteract the sexual side effects, such as a medication for erectile dysfunction like sildenafil, Viagra, or tadalafil, Cialis, or even a low dose of another antidepressant with a different mechanism of action. The point is, you don't necessarily have to suffer in silence or choose between your mental health and your sexual health. There are often options to explore with your doctor. Sometimes the conversation feels awkward, but doctors are used to discussing these issues, and they understand the importance of sexual health to overall well-being, especially as we age. Ignoring the problem won't make it go away, and there might be a relatively simple adjustment or change that could make a significant difference. It's about finding the right balance of treatments that support your overall health and quality of life. For instance, a man might be taking sertraline, Zoloft, for anxiety and depression, find it very helpful for his mood, but notice significant difficulty achieving erections. By talking to his doctor, he might learn that switching to bupropion or adding a low dose of sildenafil could address the erection issue, while still managing his anxiety and depression effectively. This is a common scenario, and solutions are often available. It's also important to note that sometimes depression itself can cause a decreased libido and difficulties with sexual function, separate from the medication. However, if these problems started or worsened after beginning an antidepressant, it's a strong indicator that the medication might be playing a role. That's why timing is an important piece of information to share with your doctor. So, we've covered blood pressure medications like beta blockers and thiazide diuretics, and now antidepressants, specifically SSRIs, as potential contributors to erectile difficulties. These are two very common classes of drugs. Now let's move on to a third type of medication that many people are taking, often for very good reasons related to heart health, which can sometimes have an impact on erections. Next, we need to talk about cholesterol-lowering medications, particularly statins. These are incredibly widely prescribed to reduce levels of LDL cholesterol, often called the bad cholesterol, which helps prevent heart disease and strokes. Statins work by blocking an enzyme in the liver that produces cholesterol. Lowering cholesterol is undoubtedly beneficial for cardiovascular health, and healthy blood vessels are essential for achieving and maintaining an erection. So in theory, by improving overall vascular health, statins might even help with erectile dysfunction in some cases, especially if the ED is caused by atherosclerosis, hardening of the arteries. However, despite their overall positive impact on cardiovascular health, some studies and anecdotal reports suggest that statins can, for a subset of men, contribute to erectile difficulties. The link is less clear-cut and perhaps less frequent than with some other medications, but it exists. The proposed mechanisms are varied and not fully proven. One theory is that while statins lower LDL cholesterol, they might also slightly lower testosterone levels, although this effect is usually small and its clinical significance is debated. Another theory relates to how statins might affect the nitric oxide pathway, which is crucial for the relaxation of smooth muscles in the penis and the influx of blood needed for an erection. Nitric oxide is a key messenger in this process, and anything that interferes with its production or action could impair erectile function. It's a bit of a paradox, isn't it? A medication that is good for your heart and blood vessels, which are essential for erections, might sometimes negatively impact erections. This is why individual responses to medications can be so different. For some men, the vascular benefits of statins might outweigh any potential negative impact on the erection mechanism, while for others, the negative impact might be more pronounced. It's also possible that the erectile dysfunction is caused by the underlying cardiovascular disease itself, rather than the statin, and the statin isn't so preventing the ED, but also isn't fully reversing the vascular damage that has already occurred. If you are taking a statin and experiencing new or worsening erectile difficulties, it's definitely something to discuss with your doctor. They can help you weigh the benefits of the statin for your heart health against the impact on your sexual health. They might consider trying a different type of statin, as some might have a slightly different side effect profile. Sometimes, adjusting the dose might help. They will also assess if there are other potential causes for the ED, including other medications you are taking, lifestyle factors, or underlying health conditions like diabetes or low testosterone, which are also common in the age group taking statins. It's crucial not to stop taking your statin without medical advice. The risk of heart attack or stroke is significant, and the benefits of these medications are well established. The conversation with your doctor is about finding the best approach for your overall health picture. For example, a man with a history of heart disease is taking atorvastatin, Lipitor, to manage his cholesterol. He notices increasing difficulty getting and keeping erections. Instead of just assuming it's unavoidable, he talks to his doctor. The doctor reviews his other medications, checks his testosterone levels, and considers whether switching him to a different statin or exploring ED treatments like PDE5 inhibitors, like Viagra or Cialis, might be appropriate, ensuring he continues to receive the crucial cardiovascular benefits of the statin. This collaborative approach is key. So we've looked at blood pressure medications, antidepressants, SSRI types, and now statins. These are all incredibly common in the older population. It's becoming clear that medications taken for one health issue can sometimes have ripple effects on others. Now, let's consider the fourth category, which often involves medications taken for pain relief, and how they can sometimes impact sexual function. The fourth category of medications that can sometimes interfere with erections includes certain types of pain medications, particularly opioids. Opioids are powerful pain relievers prescribed for moderate to severe pain, often after surgery, injury, or for chronic pain conditions. While they are effective at managing pain, they have a significant impact on the body's hormonal system, particularly the production of testosterone. Long-term use of opioids especially at higher doses, can suppress the production of hormones from the brain, like GnRH and LH, that signal the testicles to produce testosterone. This condition is known as opioid-induced androgen deficiency, OPIAD, or simply opioid-induced hypogonadism. Testosterone is a key hormone for male sexual health, influencing libido, energy levels, muscle mass, bone density, and also playing a role in erectile function, though its role in erections is less direct than blood flow or nerve signals. Low testosterone levels can decrease sex drive, and in some men, it can also contribute to difficulties achieving firm erections. So, men taking opioids for chronic pain might not only be dealing with the pain itself, which can certainly impact sexual activity, but they might also be experiencing decreased libido and erectile dysfunction as a direct side effect of the medication's effect on testosterone levels. It's a double burden that can significantly impact their quality of life. Other types of pain medications, like some anti-inflammatory drugs, NSAIDs, or muscle relaxants, are less commonly associated with direct hormonal or vascular effects that cause ED compared to opioids. However, managing chronic pain with any medication might indirectly affect sexual function, simply because pain itself and the underlying condition causing the pain can decrease desire and make physical intimacy difficult. But with opioids, there is a more direct physiological mechanism linked to hormonal changes that can impair both libido and erection quality. If you are taking an opioid medication for chronic pain and are experiencing low libido or difficulties with erections, it is essential to discuss this with the prescribing doctor. This isn't just about the sexual side effects, it's also about managing potential hormonal imbalances that can have other health implications like bone density issues. Your doctor might consider several approaches, reviewing your pain management plan to see if there are alternative strategies or medications that could reduce or eliminate the need for opioids, adjusting the dose, or considering testosterone replacement therapy if blood tests confirm low testosterone levels, though this needs careful consideration as it's not suitable for everyone and has its own risks and benefits. Again, like all the medications we're discussing, opioids are prescribed for important health reasons, and you should never stop taking them or change the dose without consulting your doctor. This is particularly true for opioids, as sudden withdrawal can be dangerous and very unpleasant. The conversation is about exploring ways to manage your pain effectively, while also addressing the significant side effect of reduced sexual function and potentially low testosterone. For example, a man managing severe back pain with prescribed opioid painkillers notices his sex drive has disappeared and he can no longer get erections. He might think this is just part of his chronic pain condition, but by talking to his doctor, he might discover that his testosterone is very low due to the opioids, and exploring alternative pain management techniques or discussing testosterone therapy could improve his sexual function and overall well-being. So far, we've covered blood pressure medications, beta blockers, thiazide diuretics, antidepressants, SSRIs, statins, and certain pain medications, opioids. These are all very common in this age group. It's clear that managing other health conditions can sometimes have unintended consequences for sexual health. Now let's move on to the fifth and final category of common medications on our list that can sometimes impact erections. Finally, let's talk about a class of medications that might seem surprising to some, but which are quite common and can definitely impact sexual function. Antihistamines, particularly the older first-generation types. We often think of antihistamines as just for allergies, or maybe to help us sleep, but they work by blocking the action of histamine, a chemical involved in allergic reactions. Histamine also acts as a neurotransmitter in the brain and plays a role in regulating various bodily functions, including aspects of sexual arousal and function. Older antihistamines, like diphenhydramine, often found in products like Benadryl, or chlorpheniramine, are known to cross the blood-brain barrier more readily than newer, second-generation antihistamines, like loratadine or cetirizine. Because they affect the central nervous system, they can cause side effects like drowsiness, dry mouth, and sometimes they can interfere with the nerve signals and smooth muscle relaxation required for an erection. They can also sometimes reduce libido. Newer antihistamines are generally less likely to cause these side effects because they are designed to be less sedating and have less impact on the central nervous system. However, older antihistamines are still widely available, both over-the-counter and in prescription combination medications, like cold and flu remedies, and they are frequently used, sometimes without realizing their potential impact, beyond just allergy relief or sleep aid. For example, someone might take diphenhydramine regularly as a sleep aid, not connecting their increasing difficulty with erections to this medication they view as relatively harmless. The mechanism by which these older antihistamines affect erections isn't as well studied or as direct as, say, the hormonal effects of opioids or the vascular effects of some blood pressure drugs. However, it is thought to involve their anticholinergic effects, meaning they block the action of acetylcholine, another neurotransmitter involved in various bodily functions, including muscle contraction and nerve signaling. By interfering with these pathways, they can potentially hinder the relaxation of penile smooth muscles necessary for blood inflow and affect the nerve signals that initiate the erection. If you are regularly using an older, sedating antihistamine, whether for allergies, sleep, or in a combination product for cold symptoms, and you're experiencing erectile difficulties, it's worth considering whether there might be a connection. This is another instance where a conversation with your doctor, or even your pharmacist, can be very helpful. They might suggest trying a newer, non-sedating antihistamine for allergies, which is less likely to have these side effects. If you're using it for sleep, they might explore other strategies for insomnia that don't involve medications with anticholinergic properties. It's important to check the active ingredients in any over-the-counter medications you are taking regularly, especially combination products. You might be taking an older antihistamine without even realizing it's part of the formula for a cold remedy or a nighttime pain reliever. Being aware of this possibility is the first step. For example, a man regularly takes an over-the-counter sleep aid containing diphenhydramine and starts noticing problems with erections. He might not think to mention a sleep aid to his doctor when discussing ED. But this medication could be a contributing factor. A simple switch to a different type of sleep aid or exploring non-pharmacological approaches to sleep might help. So, to recap, we've explored 5 categories of common medications that can potentially impact erectile function. Blood pressure medications, like beta blockers and thiazide diuretics. Antidepressants, especially SSRIs, statins. Certain pain medications, particularly opioids, and older antihistamines. It's a lot to take in, but the key takeaway isn't fear. It's empowerment through knowledge. You see, erectile dysfunction is a complex issue with many potential causes, ranging from cardiovascular disease and diabetes to psychological factors like stress and anxiety, and yes, the medications we take. It's rarely just one thing, but understanding that your prescription or even over-the-counter medications could be playing a role is a critical piece of the puzzle. It's not about blaming the medications. They are often necessary and doing important work for your health. It's about recognizing a potential side effect and knowing that you have options and that you should talk to your doctor. This is where the surprise comes in, the thing I asked you to watch to the end for. It's not a specific medication or a magic bullet. The real surprise is how often this connection between common medications and erectile issues is overlooked, both by patients and sometimes even initially by healthcare providers unless the patient brings it up. You might be accepting ED as an inevitable part of aging or a consequence of your primary health condition, not realizing that a specific pill you take daily could be making things worse, and that a simple adjustment could help significantly. The surprise is that the solution might be more accessible than you think, resting on open communication and a review of your current prescriptions. Remember, you should never stop taking any prescribed medication without consulting your doctor. These medications are managing important health conditions. But if you are experiencing difficulties with erections, bring this up with your doctor. Be specific. 1. When did the erection problem start? Did they begin around the same time you started a new medication or changed a dose? 2. What medications are you currently taking, including prescriptions, over-the-counter drugs, supplements, and even vitamins? Make a list. 3. Describe the nature of the difficulty. Is it achieving firmness, maintaining it, decreased libido? 4. Also mention any other symptoms you might be experiencing, like changes in energy levels or mood, as these can sometimes be linked to hormonal changes or the underlying conditions. Your doctor can review your medication list and consider if any of them are known to cause erectile side effects. They can assess your overall health, look for other potential causes of ED, like diabetes, heart disease, low testosterone, and explore alternatives. This might involve switching you to a different medication in the same class that has fewer sexual side effects, trying a medication from a different class, adjusting the dose, or prescribing a specific treatment for ED, such as a PDE5 inhibitor, like Viagra or Cialis, which can often be safely used alongside many of the medications we discussed, once approved by your doctor. Living with untreated erectile dysfunction can take a significant toll on your self-esteem, your relationships, and your overall happiness. It's not just a physical issue. It has deep emotional and psychological impacts. Many men feel embarrassed to talk about it, but it is a medical condition, and like any other, it deserves attention and care. You deserve to have a fulfilling sex life at any age, and sometimes the path to improving it involves looking closely at the very things you're taking to stay healthy. So, the key takeaway from all of this is, don't just assume ED is an inevitable part of aging or your condition. Be aware that common medications for blood pressure, depression, cholesterol, pain, and even allergies can play a role. Use this knowledge to have a proactive conversation with your doctor. Be open. Be honest about what you're experiencing. You might be surprised at the solutions available and the positive impact a simple medication review can have. Remember, small changes can indeed make a big difference to your health and happiness. Being informed and advocating for yourself is a powerful step. If you found this information helpful, please let me know in the comments below. Sharing your experiences or thoughts can also help others who might be going through something similar. Don't forget to give this video a like if you found it useful, and subscribe to the channel for more helpful content on living your best life as you get older. Your health and well-being are precious, and understanding all the factors that influence them is key. Live your best life at every age.